The ovaries develop up near the kidneys, just like the testes. Early on, they're generic gonads, and they both descend into their permanent locations. So when the ovaries descend into the pelvic cavity, they get anchored in place just by connective tissue. So it's suspended there, kind of like a fly in a spider web, so to speak. There's a ligament that attaches the ovary medially. That's called the ovarian ligament. And then there's a ligament that attaches the ovary laterally. That's called the suspensory ligament. And you can see the blood supply is contained within the suspensory ligament. And then there's this broad sheet of connective tissue that is attaching the fallopian tube, the ovary, the uterus. This is known as the broad ligament. Let's take a closer look at the ovary itself. Okay, so here is a closer picture of the ovary. These are fimbriae of the fallopian tube, just to get some context here. This is the ovarian ligament anchoring the ovary to the uterus. This structure is the ovary, and you can tell where this follicle is rupturing best. I think that there are two layers that surround the ovary. The outermost layer is known as germinal epithelium. It's a continuation of the peritoneum, also known as the surface epithelium. And then below that is the actual outside of the organ. That's known as the tunica albuginea, same as the testis. So the tunica albuginea is the outside of the organ. Now, looking at the organization of the ovary, it's much more straightforward than the organization of the testis. The ovary is just divided into two regions, an outer region called the cortex, which is the biggest region. All of this area highlighted yellow is considered the cortex. The cortex is the area that contains follicles. These circular structures are what I'm referring to. These are follicles. We're going to talk about those in a different video. A follicle is where an egg matures. It's where it's ovulated. All follicles are contained within the cortex. Makes sense, since the egg is going to have to leave the ovary at the time of ovulation. And then the central core of the ovary is a region known as the medulla. Here's the medulla highlighted yellow. You can see it's loose connective tissue and a blood supply.